Welcome back to the Camilla Tominey Show on GB News. Joining me now is the Secretary of State for Health and Social Care, Wes Streeting. Lovely to see you this morning, Mr. Streeting. Thank you for your time. I see you're announcing today that you're going to be sending doctors in to fast-track appointments for people who are economically inactive. This is an attempt, I would imagine, to get them back into work. But then if you're working and paying taxes, aren't you going to be feeling a bit aggrieved by this policy? Surely you should be prioritising cutting waiting lists for people who might have problems with their health or might be waiting for operations, but they're actually holding down jobs.
Yeah, it's not quite that. Set up. What we are doing is sending these teams, these further faster teams, into the 20 hospitals that are in areas with the highest waiting lists, in areas with the highest numbers of people who are off work, off sick, and that's with a focus for getting people not just back to health but back to work. We've got 3 million people in this country at the moment who are out of work because of long-term sickness. 1 in 10 are off work, off sick. We're outliers as far as other advanced economies, and we've got to deal with that because the country is paying a high economic price. And where we've sent these teams in, which is all part of the wider drive I've got to take the best of the NHS, the rest of the NHS taking the best practice to some of the areas that have struggled more, we're actually cutting waiting lists twice as fast as in other areas. So I will be applying this principle elsewhere in the NHS to make sure that where we are seeing people doing something that's innovative and impactful, they're not just isolated pilots. The NHS has got more pilots than the RAF, but they're being adopted and rolled out across the country, and that's part of the wider reform agenda we've got to take the NHS from the worst crisis in its history, get it back on its feet and make sure it's fit for the future.
We'll get into further questions about the NHS in just a moment, but just on benefits, obviously there is talk, and you've talked about it in quite robust terms, about cutting that welfare bill. We now read on the front pages of the Sunday Times and the Observer that your colleague Liz Kendall, the Work and Pensions Secretary, is backing off from some of these welfare cuts, presumably because there are some socialists in the party that object to it. Why, for instance, should anyone be getting a PIP, a personal independence payment, for ADHD?
Well, there are definitely issues in the welfare system that need reform, and Liz Kendall, the Work and Pensions Secretary, will be setting those reform proposals out in the coming days. We do need to cut the welfare bill. She's already watering them down. There are 1,000 people every... well, look, to be honest, Camilla, I've read a lot of the reports and speculation in recent days, some of which is quite divorced from the reality of what the government is considering.
What, in the Observer?
We do need to bring the welfare bill down. We've got 1,000 people signing on to personal independence payments every single day. That's not sustainable, and we want to make sure that people who need the most help get the most help, and that other people who are able to work are helped back to work. So the welfare state isn't just a safety net for those who need it, but it's actually a springboard back to work, because we've got 1 in 8 young people in this country at the moment who aren't in work. That's not a sustainable position. Our employment levels, unlike other leading economies, haven't returned to pre-pandemic levels, and that's not sustainable. So our whole focus, whether Labour, whether Party of Work, is getting people back to work.
All right. OK, let me ask you a straight question, because I know you're a straight-talking politician. Should you be getting a PIP payment for ADHD, yes or no?
I think it very much depends on the nature of the condition and the severity.
ADHD, a PIP payment.
So I think it very much depends. We are looking at this whole issue of eligibility, and we are looking at this whole issue of overdiagnosis, because I am concerned that we have overdiagnosis of these conditions. All right,
the jury's out on PAP payments. Should you be getting a 52 grand BMW from the Motability scheme if you've got ADHD? Why on earth do you need a taxpayer-funded car with ADHD?
I think that's a very good challenge, and one of the reasons why we are looking at the whole issue of welfare reform. I look at the welfare system, and I talk a lot to Liz Kendall, the Work and Pensions Secretary, and I feel like her challenges and my challenges in the NHS are very similar, in that unless we reform the system, 2 things will happen. One is that it won't be sustainable in the longer term financially, and secondly, it won't command the support of the public politically as well, because, you know, people agree that we need a a national health service free at the point of use, but they are intolerant of the waste, the inefficiency and the bureaucracy they can see. And that's not just patients, by the way. People working in the NHS experience it and are frustrated by it. And similarly in the welfare system, we've got to make sure it's reformed so it is sustainable. So we're looking at all of those issues.
Okay.
And Liz Kendall will be publishing plans in the coming days.
Let's look at you axing NHS England. What's going to happen to those 9,500 staff?
I'm glad you raised this, because I think this is absolutely the right thing to do. But I am mindful of the fact that there are lots of people whose jobs will be impacted, and there's no sugarcoating that. It's not their fault they're working in a bureaucracy that's grown beyond a reasonable size and a system that is full of waste and duplication and inefficiency. We're tackling all of those issues, and in terms of job losses, we will obviously treat people fairly, with respect, but there will be job losses in order to achieve hundreds of millions of pounds worth of savings.
How many jobs need to go?
Services. Well,
we've got 40,000 NHS managers. We've got 40,000 NHS managers who are all earning more than the average nursing salary. How many of those 40,000 have to go? How many of these NHS England staff, 9,500, have to go? Because the audience would like to hear numbers on this. I asked Pat McFadden last week, how many civil servants are you getting rid of? Couldn't give me a figure. It therefore it lacks credibility to say that you're cutting down when you won't give us figures.
So the combined size of my department and NHS England is about 19,000 people. That's double what the equivalent was in 2010, when Labour was delivering the shortest waiting times and the highest patient satisfaction in history. We want to halve those numbers. So that is a significant reduction. There are people's jobs and livelihoods affected. I am sorry about that, because I know what that fear and anxiety that it creates. But we've got to achieve those savings that we can put into frontline NHS services, and also deal with the layer and layer and layer of bureaucracy that we see in the NHS, which isn't the fault of the people who are doing the jobs they've been asked to do, but is the fault of my predecessors, and we're fixing that and sorting it out.
Although only this month there's a role advertised in the southwest of England for an NHS diversity, equity and inclusion manager on, wait for it, 122 grand. Why are they still advertising for these roles? Can the NHS, with a waiting list still at 6.3 million, afford to be spending 122 grand on a DEI role? What's going on?
Yeah, so there's two things I'd say. One is Jim Mackey and I are slamming the brakes on overspending in the NHS and making sure that we are reducing the numbers
so you're
of staff
pull that
who are
advert.
not delivering frontline services. But secondly, just to say, on diversity, equality and inclusion roles, some of them have really lost their way. I mean, I saw a report just this weekend suggesting that we should change the name of midwives to I can't even remember the name of the role that was being proposed. It was so absurd.
Mid-people.
I find that really frustrating, to be honest, because we've got black women 3 or 4 times more likely to die in childbirth.
OK, but that's great.
Black men twice as likely to die of prostate cancer.
OK, but Mr Streeting, why are these roles still being...
got to deal with, and that's
why are
what
they
we'll
still
do.
being advertised? Why are they still being advertised? If you're cutting down on them, why are they still on websites?
Yep, well, I think it is fair to say it has taken a little while for some people in the NHS to get the message. I think the announcements in recent days will have sent a very strong, clear message.
OK.
But I want to make sure that every penny of taxpayers' money is being well spent. But I would say, on this issue of diversity, equality and inclusion, some of that work is really important and valuable in terms of, poorer people more likely to die than richer people, men dying earlier than women, and real differences of the experience of black women in childbirth than white women, for example, in terms of black women being far more likely to die. I think everyone would agree those are issues we should tackle, and that's where a focus on equalities can make a real difference. But what we see too much of, and you guys have covered this quite extensively, are some well-meaning but totally misguided approaches, and that's what we'll be putting a stop to.
Back to the abolition of NHS England. I think so far since Labour have taken office, you have got rid of 2 quangos, but you've set up a new one for every 2 weeks that you've been in power. So we've now got 27 new quangos, along with countless reviews. So it's all smoke and mirrors, this, isn't it, Mr. Streeting?
Well, people will judge us on the results at the next election, and what you've heard from the Prime Minister this week is his palpable frustration with the inefficiency of the state and its incapability of delivering what people want, and frankly the fact that it looks and feels so outdated, so slow, so cumbersome. That's not a reflection on the civil servants who work in it necessarily. It is a reflection of the system, which looks far too much like
why then create more arm's-length bodies?
Sometimes the 19th century. Well, sometimes there is a role. So, for example, one of the arm's-length bodies in my department, the National Institute for Clinical Excellence, set up by New Labour when we were last in government, has done a brilliant job of driving down the price of medicines and strong-arming powerful big pharma to give us a good deal on price and to get patients access to latest medicines. So that's an example of how sometimes those reforms and those bodies can be impactful. But are there too many? Absolutely, and that's why we're trying to reduce the number.
All right. Thank you very much indeed for joining me this morning, Wes Streeting. Thank you.